So today I want to talk about Kamala Harris's stance on healthcare. She is a co-sponsor of Bernie Sanders' Medicare For All bill. So you would think she would be for Medicare for all, and she said in many interviews and on the debate stage in the last debate that she supports Medicare for all. She supports a universal healthcare system that guarantees healthcare to all people. She said multiple times she believes we should eliminate private health insurance, except in cases like for cosmetic surgery or other very specific things that Medicare for All wouldn't cover, although it should cover all health care necessities. So she said that in the past, but every time she says these things, the next day she's walking this back. She's clarifying her position that that's not really what she meant. There would still be some kind of place for private health insurance. She just would not commit to Medicare for All, even though she's a co-sponsor of Bernie Sanders' Medicare for All bill. And now we have definitive proof that she is not for Medicare for All, as people watching this think of Medicare for All. They think of Bernie Sanders' Medicare for All plan. Well, Kamala Harris has come up with her own plan titled My Plan for Medicare for All. So I guess right off the bat, she's going to use the widely popular name of Bernie Sanders' Medicare for All plan to try and take advantage of progressive voters, try to fool people into thinking this is a more progressive plan than it actually is. Let's be upfront here. Bernie Sanders has released a pledge that said that his campaign would at no point take any campaign donations from the pharmaceutical industry or the healthcare industry. Elizabeth Warren has signed that pledge saying she would not take any campaign donations from those industries. So I think we can, at least to some extent, genuinely trust Elizabeth Warren's opinions on healthcare. But Kamala Harris has not made such a pledge. She's never said that she wouldn't take campaign donations from the healthcare or pharmaceutical industry. And looking at this plan now, it seems pretty obvious that it's a kind of one step forward, but let's not go too far here. We need to fundamentally leave the private health insurance market intact, because she says specifically in her plan, it's her third point here. Well, let's go point by point. She says, first, when we pass my plan, all Americans will immediately have the ability to buy into Medicare. Yes, that is similar to Bernie Sanders' Medicare for All bill. She explicitly says that here. It will lower healthcare costs during the transition. I agree with that. Her second point here is that we will set up an expanded Medicare system with a 10-year phase-in period. Now, here's where her plan really starts to break down. Bernie Sanders has a 4-year transition period, okay? So that means if Bernie Sanders wins the presidency, Democrats take the Senate, he somehow manages to pass Medicare for All despite huge objections by the pharmaceutical and healthcare industries, but manages to pass it. Then during his term, we have the transition to a Medicare for All system. In Kamala Harris's plan, it takes 10 years. 10 years. That means if Obamacare was passed with a 10-year transition period, we would have just gotten the ACA fully implemented now. That's years and years of a fundamentally worse healthcare system. And it's the same thing with Kamala Harris's Medicare for All plan, because every year we allow people to be uninsured. People die due to lack of health insurance. If a single person does not have health insurance, the system has fundamentally failed. Maybe she doesn't understand that, but time is of the essence. We need to get this done and as fast as possible because people are dying and people are suffering out there. A 10-year phase-in period is ridiculous. Even if Kamala Harris won the presidency, immediately passed her Medicare for All plan, somehow won a second term, then 2 years later, her Medicare for All plan would just be in effect fully. I mean, she could easily lose her second term or lose after 2 terms, which is very likely because it seems like almost every time a president has an 8-year term, the next president is from the opposite party. I mean, that's just kind of how the national mood goes cyclically. So it's very likely that a Republican will be in office 8 years down the line from whoever wins in 2020. And that Republican can easily undo everything Kamala Harris or whoever the nominee is was doing in that time. That's exactly what Trump has been doing, trying to undermine the ACA. I mean, he failed by a single vote, essentially, to repeal the ACA. The same thing will happen 8 years down the line, and it'll be so much easier because it won't even be fully implemented. I mean, she's basically begging the Republicans to undo everything she does immediately after she gets out of office. Because in a huge bill like Medicare, and this is what happened during the ACA, it's pretty unpopular the first couple of years because the transition period is very difficult for everyone. It's expensive. There'll be, large deficit spending. It's a huge transition. People will be laid off. And it's like whenever old jobs are gone but new jobs are created, there will be people who are unhappy because if you think about it this way, it's worse to be fired than it is better to be hired. That's just kind of one of the biases that humans have. So any kind of large transition is going to cause some negative effects throughout the country. So an 8-year transition period, you'll have that entire time, you'll have people probably hating this new healthcare system, which is what basically happened in Obamacare. But if you look a couple of years after it's been implemented, well, all of a sudden it's overwhelmingly popular. The same was true for Social Security, just any other large transition, large spending. You're going to get a lot of backlash in the initial phase, but then a couple of years down the line, people are like, wow, I can't even believe it was so bad before this happened. So with Kamala Harris's Medicare For All bill, she is literally begging for it to be repealed before it even does anything. So that's right off the bat. Bernie's bill does Medicare For All in 4 years. I think that's a really good middle ground. It's not too sharp. It will have huge negative effects on the economy, but it's fast enough where it could be implemented, and we could prevent its repeal by Republicans with a second term in office, or at least Democrats holding Congress, and so on. So there's that. Then the third point she makes is the most disastrous by far. She says, in setting up this plan, we will allow private insurers to offer Medicare plans as a part of this system that adhere to strict Medicare requirements on costs and benefits. So she only gives 3 points here. She gives a lot of good information of why a Medicare for All plan is necessary, the struggling that the American people have due to the exploitation by private health insurance and the pharmaceutical industry. She gives a lot of good information. But of her 3 points of what this plan does, the third one is we need to maintain the private insurance industry. It's really a slap in the face to any progressive who sees her as someone who is a co-sponsor of Bernie Sanders' Medicare for All bill. We should hold her to the standards that bill, has in it, but instead, she is walking back everything she's ever said and saying explicitly, we need a healthcare system that maintains the private insurance industry. And maybe she just doesn't understand that that's what's fundamentally wrong with the system. It's not the government part of the system that's fundamentally wrong. It's the private insurance industry that prevents the government from negotiating down drug prices like many other countries around the world do to significantly lower drug costs. It's one of the main reasons why the United States pays twice as much or more on prescription drugs, because we don't have the negotiating power. I mean, even Medicare, as it currently stands, isn't allowed to negotiate with drug makers. And in this Medicare for All plan, after 10 years, you're still going to have huge private insurance companies, which undermine the negotiating power of the government-run plan, and will probably just be cheaper plans which cater to the healthy, leaving the sick and the old and the disabled and anyone who can afford their insurance to the more costly, more expensive government-run plan, while healthy people use a lesser option, which is fine until they have an emergency and end up in the hospital, and still end up in medical debt like the current system allows. I mean, that's what's going to happen. There's really no way to have a large private insurance market and succeed in your goal to have everyone insured, no one die due to lack of health insurance, and medical bankruptcy. Basically, what this plan is going to allow, and that Bernie's plan doesn't, is allow private health insurers to kind of, get around the system. Like in Bernie's plan, health insurance companies cannot cover things that are already covered in the Medicare system, whereas this plan that allows that. So you can have rich people, the wealthy, the top 1%, buying more expensive private insurance to get treatment at the finest hospitals, the best doctors, while everyone else is stuck with the regular health insurance that can only be taken by doctors who aren't as good, because all of the profit will be in the private insurance industry. I mean, that's why it's so dangerous to leave the private insurance industry alive in life-saving treatments, life-saving situations. You're just going to get a lot of wealthy people, just buying better health outcomes than the poor. And that's what the healthcare industry wants. They want to keep this for-profit motive alive. I mean, don't even get me started on this. Also leaves the healthcare lobby intact. It completely leaves, billions of dollars to pay for, healthcare advertisements, healthcare executives to lobby Congress to undo this very bill. I mean, it's going to take 10 years. They have plenty of time to buy the elections in favor of Republicans or centralist Democrats who want to completely undo everything this bill would do. So what it basically does is leave the system fundamentally intact. Now, is this better than what we already have? Absolutely. But to call this Medicare for All is just an absolute slap in the face to progressives like me who want a system that treats people, is measured in health outcomes and not profit. This leaves the profit motive completely intact, doesn't get rid of private health insurance, the private healthcare lobby. I mean, Kamala Harris, this is really sad, honestly. I mean, she says right here, this isn't about pursuing an ideology. This is about delivering for the American people. This is the type of just jargon, meaningless BS that politicians are just going to keep spewing to try to convince the American people that what they're doing is in the best interest of the people, when it isn't. She could keep spewing hot air, but when it comes down to it, she does not support Medicare for All. She supports a private health insurance model that takes 10 years to even, go into effect. Meanwhile, it'll definitely be repealed by then anyway. Kamala Harris, come on. I mean, don't play dirty like this. Just because you're better than Joe Biden doesn't mean progressives are going to support you. And we must fight Kamala Harris as much as we can to support candidates like Bernie Sanders, who support true Medicare for All that saves lives, saves money, saves people. And the worst part about this is that she specifically talks about how Bernie Sanders' bill would put a 4% tax on working class people. 4% premium, I should say. She disagrees with that. She says we don't need a tax on working class people to pay for a Medicare for All system. But, I mean, that's just a lie. I mean, Kamala Harris is running on, she has two priorities. One of them is Medicare for All, which she finally laid out in this article. And the second one is a middle class tax cut to cut taxes on the middle class. But those are two fundamentally antithesis ideas. You can't cut taxes and then have one of the largest spending increases the country has ever seen in its entire history. That's what the Republicans do, okay? It's a lie, it's a tactic they use, and then they go fear-monger of their deficit to cut Social Security and other entitlement programs. Well, Kamala Harris, I mean, don't use the Republican playbook, because that's really what I'm seeing here. You said you could pay for it by a tax on Wall Street. I mean, Bernie Sanders also wants a tax on Wall Street, so that's just kind of fundamentally dishonest. I think he said the tax on Wall Street would pay for. I think that was part of his eliminate student debt plan, which, by the way, Kamala Harris just came out with a eliminate student debt plan, which literally, here's what it did. It eliminates student debt to Pell Grant recipients who start a business in an underprivileged area for at least 3 years. Are you freaking kidding me right now? How many people qualify for that? Like a couple thousand in the entire country? I mean, who are you playing towards? I mean, that's like moving forward like a micrometer. Okay, I couldn't even see that as a positive thing because it is so utterly meaningless to the average American. It's ridiculous. I mean, she just fundamentally doesn't understand the struggle that people are going through, or she's hoping and praying that she gets the healthcare, the pharmaceutical industry, huge lobbying groups to fund her over Joe Biden because they see her as a better candidate, a minority candidate. She likes to talk about it a lot, that can inspire more people. They're nostalgic about the Obama days where Obama ran very similar campaign on progressive ideas, but in the end was taking huge amounts of money from large corporations and fundamentally changed very little in the actual system in his 8 years of office. It would be the same thing with Kamala Harris. Let's not let it happen. Have a good one. Subscribe for more. Peace.